Please welcome co-founder and CEO of mPharma, Gregory Rockson, CEO of Elephant Healthcare, Bahbak Miremadi, and Senior Vice President and Head of Zipline Africa, Daniel Marfo, in a conversation with Semafor's Kadia Goba on advancing health innovation in Africa.
All right, well, thank you everyone for coming, and especially thank you to my panelists. I am going to introduce everyone again. This is Gregory Rockson, co-founder and CEO of mPharma, one of Africa's pharmacy-led primary care providers. Bahbak Miremadi, a CEO of Elephant Healthcare, focused on digitizing healthcare infrastructure, and Daniel Marfo, Senior Vice President and Head of Zipline Africa, a startup drone service delivery service that has incorporated healthcare products as part of their service. So thank you all for being here. I guess we should start with something we're all familiar with in terms of healthcare, the pandemic or COVID-19. And I guess given the fact that Africa was at the back of the line for COVID vaccines when the world was scrambling for them, if anything, what is being done to make the continent better prepared for the next global health crisis? And I'll start with you, Bahbak.
Okay, so I think that what is the continent doing to prepare itself for the next health crisis? In some ways, ironically, a lot of countries were already prepared for a pandemic in Africa. There were actually processes in place. They were psychologically ready for it. And although there was subsequently a problem with vaccine dissemination, in terms of the early phase, the sort of PPE phase, I think in many ways African countries were better prepared, were on a front foot. I think that, like the rest of the world, many lessons have been learned. And I think that Africa is looking towards technology as a way of leapfrogging, perhaps even, some of the challenges that developed health systems have. So I think that, we at Elephant deal and work with governments, and governments are looking for a range of solutions, including technology, to help them prepare and accelerate the growth and development of their health systems. And I think COVID has taught everyone the importance of technology and the potential of technology when it comes to healthcare, and that plays out in Africa as much as anywhere else.
Well, Daniel, specifically, you are specializing in making sure things are being delivered to individuals. I guess, how is your company preparing for the next pandemic? And also, I'd love you to take us through how you get an order for whatever medicine is required and then the final drop.
Yeah, I think with COVID-19, when it happened, I think one of the hardest things when vaccines became available was making sure everyone was vaccinated, right? And it's not just about vaccinating the person in the city, it's about making sure everyone was vaccinated. And the thing sometimes we forget was the vaccines were in short supply with very short shelf life. And the way that Zipline contributed was in ensuring that even though we had short expiry, cold chain vaccines, people outside of the major cities all got vaccinated. In the first 12, 18 months, we delivered over 4 million doses of COVID vaccines, ranging anything from Pfizer to AstraZeneca. And it is about having technologies like was mentioned that leapfrog today's challenges, right? With the current infrastructure and systems we have, there was no way in countries where we worked, you could have vaccinated all those people without having the problems of things like reverse logistics. Because that was also a big part of COVID, right? You get the vaccines out there, there's vaccine hesitancy, you can't vaccinate, the vaccines are stuck. You can't bring them back. And so I asked myself, how do we prepare for the next pandemic? It is by investing in technology is by investing in human capacity, is by investing in resilient systems, such that when it does happen, we are all prepared, and within the shortest possible time, we can react.
And specific to your industry, can you tell us, walk us a few seconds on what it means to order something and then it be delivered?
So I would still take the vaccine example,
Sure.
right? So we had the scenario where we have ultra cold chain facilities at our distribution center, and the health workers would generally sensitize people to get vaccinated. And so when they counted, maybe they have 20 people who are willing to be vaccinated right now, they would either send us a WhatsApp or call us on a toll-free line, or use the Zipline app and reach out to us. And then we confirm the order with them. Within 3 to 5 minutes, we have their vaccines packaged and on a drone. The drones are all pre-programmed. They know where every health facility is. We have GPS coordinators, routes prepared, and it flies there. And by the time the drone is leaving, the health worker knows exactly what time it should land at their health facility. And when it's 5 minutes away, they get another alert. And when it delivers, they are able to now utilize it. The cool part is the packaging that we use can also store those vaccines at that temperature for up to 3 hours. So even if you don't have, cold chain systems, as is the fact in many parts of rural Africa, you can still be able to keep it under great conditions and vaccinate everyone.
Gregory, your company has a very different approach to disseminating medicine. You want to talk us through this and how you traverse through the pandemic?
Yeah. What I like to tell people is that the next pandemic will show up in a pharmacy first. Because when COVID started, there was a joke in Ghana. At some point, we said the malaria-demic. Because at some point, everyone was saying, oh, I have malaria, when really it wasn't malaria season. It was clearly people having symptoms of COVID thinking they had malaria. And so at the beginning of the pandemic, actually, we ran one of the largest pharmacy networks on the continent. And so we took our data and we actually built a dashboard for the government of Ghana. And we said, these are the 350 drugs that people would use to treat symptoms of COVID. If you see a spike in people buying these drugs in these communities, and also this is the historical consumption trends before COVID. If you see any spike that goes above the regular consumption trend, you should probably go do some community-based testing. As to whether the government uses it, I don't know. But we could always tell, we could always know when there was a new COVID spike before the government announced it, because we would always see that in our data. So I say this to say that the way people get healthcare in Africa is through self-medication. Like when you are sick and you need to first start that care journey, you walk into a pharmacy, you get a free consultation from the pharmacist or pharmacy technician, and then they sell you your drug. So if we are to sort of start asking ourselves, how do we reimagine and build a proactive health system? Then we have to actually go to where people go to when they need care, which is their local pharmacy. And then we have to start building a data infrastructure that allows us to start getting that information and then connecting that information to a much more broader national reporting system. Unfortunately, most African governments do not link data from their local community pharmacies into the national health data reporting systems.
Well, I want to dig into that. The UN reports that Africa imports more than 80% of its pharmaceutical and medical consumption. What are the prospects for the production of drugs inside the continent?
I think it's a noble idea for us to invest in manufacturing. I am more concerned about the business of manufacturing. Are we ever going to be very competitive to India? I don't think so. It will require more protectionist government policies that sort of shuts down supplies from other countries that have scale, right? I don't think any single country on the continent would ever have the skill that India has when it comes to manufacture. So I think it's a noble idea. I think it was not a good idea for so many countries to, because of COVID, just jump into let's start doing vaccine manufacturing. It was like being reactive to something. If you wanted to do that, you should have done that before COVID happened. But I think that what we should focus more on is on how do we ensure that the more basic, and there's also the reset that goes into it, right? So you have to actually have a scientific community that can do R&D to actually do manufacturing. You just don't start doing manufacturing, just like that. So I don't know, I think it's a noble idea, but it's not, I don't think it's the biggest priority for Africa.
Outside of COVID vaccines, I mean, just in general?
I don't think so.
All right. We've seen a surge of investment in telemedicine and other solutions such as digitized inventories in recent years. To what extent will that have a lasting impact? Was that very COVID focused, or do you think that's something that will continue in the continent?
No, I actually think if we're ever going to get somewhere, digitizing our inventory is the basic, right? If I don't know what I have, where do I start from? And so I think there has been a lot of limelight on that, and that is a trend that I don't see stopping, and that is a trend that we should all support, because the more that we invest in the technology and the human capacity building, the better we are able to focus, the better we are able to analyze the data, the better we are able to take control of our own healthcare. So I think it's a trend that is worth supporting, and it's a trend that we should continue to move towards.
I guess one more question I have for you. I think we talked about this backstage. We talked about brain drain, and I'm curious if you think, if you don't know what that is, it's just the idea that sustaining healthcare workers inside the country or continent has been a problem. And I want to know, do you see any future in changing that? Do you see any resolution going down the line? I know if you talk to many people, it's about money. And I'm curious if you see anything in addition that can be done to, I don't know, like fight brain drain.
Yeah, I think that, and Greg referenced it a moment ago, so I think that the basic thing that health systems need is accountability. And that applies across the board. You want a data-driven health system where you're able to gain the insights that Greg was highlighting through his pharmacy network. As I said, we digitize public health systems. So more than 50% of healthcare provision, particularly in sub-Saharan Africa, is driven through public health owned and run facilities. And they have a real problem with staffing. And they have a real problem with accountability when it comes to staffing. And then from the staff's perspective, they have a real problem for getting paid properly on time for the shifts that you did. So there is a huge HR challenge. And the solution to it lies in accountability. You need more accountability in the system. And that, from every angle that you look at, you want a system that essentially connects up all the people and all of the data and gives you accountability. And that is the starting point for transforming health systems in whichever way you look at it.
Sure.
I say something. I mean, whilst I said manufacturing was not my biggest headache, this is a problem I live with every day. I think the biggest problem facing Africa's health system is a health worker problem. We are literally creating a crisis where we are having the best minds leaving the continent because the UK NHS is hiring every single health worker they can find. Our African governments are not being proactive to create incentives that will keep health workers inside because it's a job. Like, they have families, they want to be able to get paid well. And that's the problem. Like, we bought a pharmacy chain in a country, I'll mention it. The first problem I had to face was that on day one, when I entered the office, 45% of all the pharmacists employed by the pharmacy chain this year had left the country and gone to the UK, gone to Canada. 45%. How do I replace 45% of my workforce if 45% of them leave in a year? So that is the biggest problem. It's not like, I like software, I build software. Like, the biggest problem is we got to figure out a way to incentivize healthcare workers to stay. Because whenever a doctor leaves, it takes another 7-10 years to be able to replace that doctor.
I have one comment to that.
Last
Yes. And I think we've talked about what the government is doing, and Gregory said it right, that when he went, this was the problem. And I think sometimes we should look ourselves square in the face. And are we even incentivizing the people to do the right thing? A lot of people here work for companies that have offices in, in Europe, in America, and in Africa. Can they hold themselves accountable that they create equity for all their workers, be it healthcare workers, whether they were working in Europe or they were working in Africa? And I think that is the question we should ask ourselves. We can blame the governments, but are we doing the same thing?
Well, thank you, panel. Thank you for having us.